The Philippine Nurses Association of Nevada now brings you Filipinas, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, good evening, Filipinas listeners and followers. Magandang gabi po sa inyong lahat. We hope that you're all keeping safe out there as we are still in the midst of this COVID pandemic. So our program, Filipinas, is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with our favorite radio station, PHLV Radio. So thank you so much for joining us tonight. And I'm also proud to say that tonight we have a co-host who is a member of the Philippine Nurses Association Board of Directors. Please welcome Mr. Lloyd Gamboa.
Hello, good evening, viewers, and thank you again, Ms. Doris, for allowing us to join you tonight.
Of course, Lloyd. Looking good there. Okay. So we just had a fairly hot summer. It's almost ending, and October's just around the corner. October is the National Fire Awareness Month. And, you might know that a fire injury occurs every 30 minutes. 44% of all admissions to burn centers result from a fire or a flame burns. 33% of all burn center admissions result from scalding injuries caused by wet or moist heat. Direct contact from a hot source accounts for 9% of burn center admissions. And as you also know, or you may not know, that there are very many educational programs out there that create awareness on the prevention of burns and fire safety. So tonight, we invited 3 guests who are going to enlighten us in this matter. So please welcome Mr. Robert Acevedo, Ms. Yasmin Conaway, who's joining us via Zoom. Hi, Yasmin. And of course, Ms. Cheri Filewood. Welcome, everyone.
Good evening.
Good. Okay. So just to give you a little snippet on our guests, Mr. Robert Acevedo is a firefighter/engineer with the Nevada National Security Site Fire Rescue, and he is a Reserve Firefighter with the Boulder City Fire Department. He has been in the fire service for 14 years and is currently the secretary of the board for the Firefighters of Southern Nevada Burn Foundation. Welcome, Robert.
Thank you for having me.
You have anything to add to that?
No, you nailed it all. So, thank you.
Okay, thank you. And of course, we have Ms. Yasmin Conaway. Yasmin has been dedicated to burn care for the past 15 years. She started as a direct burn care nurse in California before relocating here to our fabulous city, Las Vegas. Her burn nursing passion has brought her to UMC and is now the burn program manager there at the UMC Lions Burn Care Center. So Yasmin oversees burn verification and burn accreditation for UMC, amongst her other jobs. Right, Yasmin?
That's right.
You have
Thank
anything
you so
to
much.
add? I'm sorry? Yeah.
I'm happy to be here. Thank you so much.
Oh, you're welcome. Okay. And last but not the least, our third guest is not a stranger to Filipinas. She was here a couple of years ago, and she is Cheri Filewood. She is a registered nurse at UMC for the past 28 years and has worked at the Lions Burn Care Center for the past 14 years. Cheri is an American Burn Life Support instructor for the last 6 years and loves to attend various community events such as health fairs, Firestation open houses throughout the city, and to educate people on burn prevention. So welcome, Cheri, to the program.
Thank you for having me back.
Oh, of course. We're excited. So we're going to start with the questions and put Lloyd on the spot here.
All right. Okay, Mr. Robert, we're going to start with you. You are a reserve firefighter of the Boulder City Fire Department. Can you enlighten us about the duties of firefighter?
So the duties of a firefighter, they vary depending on what incident might be called for, and it ranges everything from emergency medical services to fighting fire, hazmat incidents, technical rescue. But the bulk of our 911 emergency calls are emergency medical calls.
Okay.
So not only outside of 911 calls, we do fire prevention, fire inspection on businesses in our area, and then we have our general training duties and our station duties in the meantime to keep us busy.
Okay.
All right.
Okay. You're a busy guy.
Yeah.
Yes, I don't know how I do it sometimes. But
Welcome to the
it's
club.
good. Yeah.
Okay.
You are also currently the Secretary of Firefighters of Southern Nevada Burn Foundation. What exactly is the Burn Foundation, and what are the goals of this foundation? Can you give us an overview of this foundation?
Yes, so the Burn Foundation was actually started years back by a handful of firefighters who, at the time, responded to a fire. There was a family displaced, and once they were done with their firefighting duties, they basically stayed after and said, hey, we can't leave these people without anything. So that's when the Burn Foundation was kind of born. And since then, we focus on a couple different things. Our first one is the Burn Survivor Initiative, that basically we, focus on kids, but if adults need help, we will accommodate them as well. But we raise our primary funds for this Burn Survivor Initiative, and that allows kids or adolescents to go to 3 burn conferences throughout the year.
Wow.
So we have a summer conference, winter one, and then the World Burn Survivor Conference, I believe it is. So that's where our funds will mainly go for those, for that support. And it doesn't. So one thing we try and reinforce is we're not just sending the kid or the burn survivor. It also, they may require a nurse or a caregiver to accompany them. And roughly for each one, I want to say it's just under $800 per kid to send them to each conference. So we also do various community events. I'm sure most of the listeners out there have seen the fire trucks in front of the Walmarts. For December, we do underprivileged toy drive for kids.
Yeah, I donated to
Yep,
that.
so that's us. So stop by, say hi. We'll collect toys throughout the month of December, and then distribute them through various schools or organizations. And then again, if there's an incident or something happens, we will donate funds to, say, a family who's been displaced to help them get through that initial period where they're lost their belongings, and we'll donate to help get them situated for that short time being.
Fantastic. That's great.
That's great. Who are the members of this foundation?
So the members, we vary between the major fire departments in Southern Nevada. So we're compromised. There's a handful of us that are on the board. We're represented by the Nevada National Security Site, Creech Air Force Base, City of Las Vegas, Clark County, City of North Las Vegas, Henderson, and Nellis Fire.
Wow.
Yeah, and then those are our primary board members, and then we have key volunteers from those various departments that'll assist us as well.
Very good. Very good.
What does the foundation do for the community? What community outreach programs does the foundation engage in?
So the community outreach programs, we'll team up with some local other charities. I know we do some stuff with the Southern Nevada Red Cross. Basically, it's just whatever we could help with on top of what we do for the Burn Survivor Initiative, and then the toy drive being our other major event throughout the year. That's a
Right.
planned one.
That's good.
So
That's good.
Well, I know October is one of the busiest months for you guys.
Yeah.
yes.
October is the National Fire Safety Awareness Month. As a firefighter, Can you tell us why fire safety awareness is important and why it is important to make sure that the individuals know how to respond during a fire drill or a fire hazard?
Yes, October is very busy for us, on top of the fire prevention or fire outreach programs. We do a lot of community outreach programs. We're busy in October. We get a lot of requests from schools to come out, give a demonstration, show off our gear, show off a fire engine. And unfortunately, when we meet children, it's for the first time, it's in an emergency situation.
Oh.
So one of the things we like to do when we go out to these schools or community events is let the children see our gear, let them see what we look like when we're dressed in our full gear with our masks on, so they're not scared in an already terrifying event. They know we're there to help, and we'll do what we can to help them. Also, we have a lot of groups that will come by the local fire stations,
Yeah.
come check out the trucks, come, touch things, put on some gear, and it's just about building that relationship with the community that we serve. So
That's always a great thing for
Yeah.
kids, and
It is.
It inspires them as well to become one of you guys, right?
yes, and and then it brings back some of that passion for us who are already doing it. When you see a kid smile, or you can let them honk the horn of the truck, or so it's good on both sides.
Very good, very good. Well, thank you for that. It looks like your foundation is actually hopping out there. Let's switch to the ladies. Yasmin, you work at the UMC Burn unit as a program manager. Can you tell us a little bit about your job there?
Yes, so as the burn program manager, I oversee burn verification, which is burn accreditation for UMC. It's a true mark of distinction. It basically says that we provide the best comprehensive multidisciplinary care to our patients, from initial injury to discharge and even after. So essentially, what does that mean? It's a checklist of best practices in the best world that sets up the patient for success. Some of the things that we look at for verification is working closely with physical and occupational therapy to restore function. So we know that our burn patients, they can lose function very easily. So having really tight collaboration with them is really important. Having collaboration with our dietitian, they require a lot of calories and protein for wound healing. So making sure we have a really tight relationship with our dietitian, working with case management, social work, so that when they do go home, they can be discharged safely with the equipment that they need and the aftercare that they need. So having the collaboration is really important, and that's a big part of verification.
That's great. That's great. Anything else to add to that? I know you guys are very busy, and so let's switch a little bit to Ms. Filewood here. Cheri. Okay, Cheri, hi. Welcome back.
Yeah, thank you.
It's been a couple of years. Okay, so you have been working at UMC for the past 28 years, mostly in the burn care unit. Can you also tell us about your job there?
Yes, I've been there for the last 14 years. I would have to say over my entire career, it was probably the most demanding and emotionally taxing job that I've had, but it is the most rewarding job. So caring for our burn patients, seeing them from the initial beginning, helping them through their treatments, their burn healing, assisting with their range of motion, just getting them up, seeing them go from not being able to move and function and feed themselves to being able to walk and actually leave and go home. And just involving the families. The families are very important too with their healing. So I'm providing all of that emotional support for them. So it's very, very rewarding. And then one of the best things too is most of our patients will come back and see us. So a lot of them follow up at the burn clinic, which is right outside of our inpatient clinic, and they will come back and visit. They will give us updates. They come back to say thank you.
That's great.
We have patients that live out of state, and they will still send us updates and cards and everything to say thank you. So that is the most rewarding part of it. It's just working with our whole team, with Yasmin, with our doctors, all of the staff. Everyone's just amazing communication. And our one goal is just for our burn patients and families and to get them back into society as best as we can. We are doing some more burn research on our floor with nursing. So we're looking at ways to decrease their pain medication, opioid use with that opioid epidemic, and then going to more of non-pharmacological alternatives such as like meditation, relaxation exercises, music therapy that we use with their dressing changes to help with distraction. We're also looking at healing touch and aromatherapy. And it's just really them and the family. So, watching them and teaching them and all of that.
That's great. That's great. And just for the listeners, for everyone, Lloyd also works at the burn unit, right?
That's right. That's right. I work with Cheri for 14 years now in burn care. That's what she said. It's one of the most rewarding job or position in UMC. It's like what Cheri said again. Like when the patient comes back and say hi, and say thank you, and they hug you. I think that's the most wonderful feeling.
Exactly. That's wonderful. And for those of you who are not in Nevada, UMC stands for University Medical Center. Okay. All right. Okay. So Yasmin or Cheri, you can tackle this question, either one of you. Can you give us a brief history of the UMC Lions Burn Center? Why is it called the Lions Burn Center?
I can go ahead and jump in on this one.
All right.
So the Burn Center created about 53 years ago. Just before that, about 55 or 56 years ago, there was a UMC physician whose daughter was badly burned in an incident. She was taken to UMC and treated there, but unfortunately she did not survive her burn injuries. During that time, that physician was also a Lions member. And the Lions, they look to the needs of the community. And during this time, he said there was a need for burn care. And the rest of the Lions Club agreed. And it took about 3 years working with UMC to create the Burn Center. But in collaboration with the Lions Club, they created the UMC Lions Burn Care Center. And even to now, for the past 53 years, the Lions Club has been instrumental in keeping our patients continuing the care that they need. So any additional needs that they have always jumped on board. One example of that is now if there's a patient that goes home that requires pressure garments, those are really tight clothing essentially used for burn scarring. We provide that for our patients. A lot of times insurance companies don't cover it, and it does become costly because it has to be specially made for each patient. So they help to provide funding so that they can get 2 pairs of pressure garments when they go home.
Okay. All right. So that's really good to know that history, why it has been called the Lions UMC Burn Center. So the Lions Club District 46 is a big supporter, right, of the UMC Burn Center. And Cheri, maybe you can ask this. What does the Lions Club do? And can you give us a brief description of what this nonprofit organization is all about?
Yeah. So the Lions Club is a nonprofit organization, and it started back in 1917. The mission is to serve, so to serve their community. It's a place where individuals can come together as a group, and they're being able to give their valuable time to serve their community and just help with the world, and just the world itself. So the Lions Club, they are big with having missions preventing blindness, preventing the diabetic foot awareness, They help with kids' cancer, helping the environment in general, and then help feeding the hungry is what they do. District 46 Lions Club, which is connected to the Lions Burn Center, they provide specific vision screenings for the community, so they will do those frequently throughout the entire community and at different events. They also provide diabetic foot screenings. They have a yearly event where they dress the kids, so any underprivileged kid can come in and they can pick out a complete outfit, 1 or 2 complete outfits at no charge. So they will do that yearly. They help feed the hungry. They will do bag foods for the underprivileged children as well. So there's just a lot of things that they love to do.
That's great. That's great. So there is a working relationship between the UMC Burn Care Center and District 46 Lions Club, right? So can you explain I know you mentioned a lot about their community involvement. What is the relationship between UMC and the Lions?
Yeah, so like Yasmin had said from the beginning, they've still remained a huge supporter. For the UMC Lions Burn Center. Back when we first opened the new building, they had donated new beds. So we had specialty air beds to help with our patients that were like state of the art at the time, help with like skin prevention with any kind of injuries to their skin since they already had those burns. All the way through to they donated recliner chairs for each of our rooms. So that allows one of the family members to spend the night, and actually the chair will recline right down into a bed form. So that's very important to have that family there for the support of our patients. They will assist us. We do our annual open house during Burn Prevention Week. We'll have our room set up and simulation for people to come through and look at our open house, to look at the burn, what we do at the burn center. So the Lions Club will help organize and help with that and volunteer. There's the annual Little Roar holiday party. So every year we have a holiday party for our pediatric patients. So they will help with that. They will do preparation, planning with us. They'll do gift wrapping from all the toys we get from the Burn Foundation. There's Santa and Mrs. Claus, and then they'll just help volunteer during the entire event. And then, of course, we have thanked them, so they've been a huge supporter of us. So we did, like 2 years ago, give a actual bench that is out in our burn care clinic area that is dedicated to them with a plaque with Dan Louie for it.
Awesome.
For a thank you.
Okay. Oh, great. Yasmin, you're back, right? Okay. I think she fell off for a minute.
Sorry,
Technical difficulties, right? Yeah. Okay. But what are the different programs at UMC Burn Center is involved with in terms of creating public and patient awareness of burn prevention and fire safety?
So we work closely with various community organizations. As we had talked about already, we've been working closely with the Lions Club, the Burn Foundation. We work closely with the local and fire departments and EMS agencies. We provide education to them. We participate in many health fairs and open houses to share prevention tips and focus on really seasonal things. So as you mentioned, Doris, the summer was really hot, and we saw a lot of pavement burns. That's one of the big things that we see in the summertime. One of the things that we focus on is our flip-flop campaign. With the Burn Foundation, they help to collect flip-flops. We also reached out to Old Navy. They donated a lot of flip-flops as well, so thank you to them. Shout out to Mercedes. She did a great job in providing flip-flops this summer. We were able to hand out over 400 flip-flops in the community, preventing pavement burns in the community. So just to give you a little background, when it's about 110 or 120 degrees outside, the pavement can get as hot as 160 or 170, and it only takes a few seconds with somebody touching it to get a burn, a second or third degree burn. So one of the things that we like to do is to make sure that everybody has something to cover their feet. So just making sure that they have flip-flops at the very least, so that when they go out in the hot summer months, they're protected. And then we also shift during the holidays. So we switch gears. We look at cooking injuries, we look at space heater injuries. So then our focus changes when we go to these health fairs and community events, really targeting these areas. One of the other things that we also do is we work with at-risk youth, preventing burn injuries from misusing fire. So some of these kids are either referred to the program by the Department of Juvenile Justice or by concerned parents and families. We provide education to the youth, the child, and their families, just so that they know the consequences of fire and that they can use it safely and appropriately.
That's great. I know you have a lot of programs, and thank you for giving us the bullet points. So, Robert, what is the relationship between the Firefighters Southern Nevada Burn Foundation and the UMC Burn Care Center? How do you help each other?
So I think we have a really good relationship. You know, the Burn Center is, you know, the only one down here in Southern Nevada. So chances are, you know, if there is an injury or a burn, we're going to, you know, as emergency responders, see that first, transport them to UMC, and then we'll get some follow-up from the nurses on how the patient's doing. I think we got a good relationship. A lot of the events that we do are for, you know, some of the stuff at UMC. I know a couple years ago, I think we donated some TVs, some iPads to help keep some of the patients occupied or, you know, take their attention away from why they're there. We also host the Bachelor Auction, you know, as a yearly thing where a lot of the funds that are generated from that event go to help with events that the Burn Group puts on. Yasmin mentioned the flip-flop drive. I know that was a pretty big rollout this last summer, and we actually still have flip-flops at our office because we were still getting them after the deadline, so we'll be good to go for next year. And then I believe we're in the process, too, where we actually are going to have Yasmin as our UMC board director for the Burn Foundation. So it's really beneficial to have someone on their side, you know, walk us through what's going on after, say, we drop them off, because we're emergency care and we kind of end ours when we, you know, transfer it over to them. So it's a really good relationship, and we seem to feed off, both groups seem to feed off each other.
Very good, very good. Interested in that flip-flop drive. That's fantastic. Do you have flip-flops for doggies?
I do for mine, yes.
I need them too.
I have to find that for my little dog. Anyway, okay, so I know you've had many events where the Lions Burn Center and Firefighters Foundation have worked together. You do have an upcoming event, fundraising event. I know fundraising is important and especially difficult in COVID times. So can you, I know you do have an upcoming fundraiser like Cheri on October 9th. Can you tell us about this event?
Yes. So we got together, and I know the Lions Club and the Burn Foundation are always donating to us. We decided that we would do an event together so that we could help. Rather than just receiving, we wanted to actually give and work together as a team. So this is a great opportunity. It is going to be a bowling fundraiser. It is Saturday, October 9th, so it'll be coming up in a couple of weeks, and it's going to be at Sunset Station Strike Zone. The event itself is going to be from 11 in the morning till 3 in the afternoon. It will include, there are various different tickets that you can buy for the fundraiser.
We're flashing the on screen your flyers, okay?
Good, yes.
So, yeah, go ahead. Yeah,
With
so-
all of that on there.
Yes.
Yes, it's called Pizza, Pins, and Prevention. So it's
right.
fundraiser for Fire Prevention Week. And then the proceeds to go to UMC Burn Care and to help with those burn patients and everything that we do with that. So it includes 2 hours of bowling. So you have a ticket that you can have for 2 hours of bowling for 4 to 5 bowlers. It includes the shoe rental. So we want to have lots of fun. If you don't want to come, you can sponsor a burn family. So we have a lot of different options. where you can actually sponsor a burn family to come bowl and have fun too. So it's just really for everyone to get together and mingle and just have a lot of fun. So there's different options if you go to the Eventbrite site, to that QR code that's on the screen. You will see all the different options. There's some more sponsorship options that are available as well. But it's just really that 2 hours of fun. We're going to have different trophies, best bowler, highest score, the lowest score. Who gets the most gutter balls?
That would be me.
I know. That'd be me. Lloyd thinks he's going to have the best highest score.
Yeah,
he's
I'll try to beat them all.
Yes, he's actually been going and practicing bowling like a couple times a week, so he's cheating.
What's your average?
That's a secret, man.
Oh, I can tell you. My average is 150 for 3 games.
Oh.
Well, maybe we'll win a trophy. Yeah, so we'll have some fun trophies. There'll be door prizes we're going to give out throughout the event. There's a big raffle table and then a 50-50 raffle, so with that. And then that bowling is from 12 noon to 2 o'clock. The event being 11 to 3, that part of it involves the educational part. We're going to have tables out front in the lobby. So we'll have different educational information that people can look at, talk to, take some stuff home, pretty much on fire prevention, fire safety, alarm safety, how do you escape your house if there is a fire. So you want to make sure you have an escape plan. So we can give information for that. That will go from all ages, from children all the way up. So out front, we are planning to have the Pink Pearl fire engine.
Oh, what is that?
And so that is actually a fire engine that is painted pink for the month of October.
Oh, my kind of truck engine.
See, yes. So it is for the month of October with Breast Awareness Month.
Oh,
and
okay.
they drive it to different events, and they actually will let everyone go on and sign. So the fire truck actually has everyone's signature on it.
Thousands of signatures on it, and it's a very popular, very attention getter.
Gotta get my signature in
Yeah,
there.
yeah. So when we wanted to have a fire engine out front, because a lot of our events will have fire engines, like our annual Little Roar Pediatric Burn Survivor parties, will have the fire engine come so that the kids can have pictures and look at it, talk to the firemen. We love Strike Zone, but they wanted to make sure it was friendly. They didn't want people to think there was an emergency going on.
Okay.
So,
Sure.
we were like, well, we'll put a banner, we'll put balloons on the fire truck, and then we thought, what about the Pink Pearl fire engine? So that's how we got that one. Yeah.
Okay. All right.
And then we're also going to have another trailer that Yasmin's going to talk about that she arranged. That will be out front as well.
Okay.
So the Las Vegas Fire and Rescue, they have a trailer, a simulation trailer, that will be at the event. And this trailer is set up like a house. So there's a kitchen, there's a bedroom, and it's set up so that there is a fake fire somewhere in the house. So let's say the fire starts in the kitchen. Everybody in the house is then, there will be fake smoke that goes into the air. So then everybody in the house has to get low down to the ground and actually crawl through. So they get the true simulation of what it's like to have smoke in the house, the limited visibility, and then actually crawling to a safe exit. So whether that's the door or getting to a room, a window, and crawling out the window using an escape ladder. So they have all of those tools available so that everybody can test it out and see what it really feels like, and then take those lessons learned home so that they can practice that at their own house. It's actually a really great thing, and I'm so excited that we're going to have it there.
That's great. Oh, I'm excited. We gotta go, right?
Oh, yeah.
We gotta go. So you don't have to be like in a league. You can buy tickets individually, right?
Yes, it's for the whole community. So anyone that wants to come out and have fun, they can go to the site, buy the tickets. Yeah.
Okay.
Don't even have to be a good bowler. Just come have fun. Pizza, drink, and fun.
I'm so glad. Okay. Well, we'll be there for sure.
Yes.
So thank you for explaining the event. So, okay, the event is called the Pizza, Pins, and Prevention Fire Fundraiser, to be held on Saturday, October 9th, from 11 a.m. to 3 p.m. at the Sunset Bowling Lanes. I think it's called Strike Zone, right? Okay, so like Cheri and Robert and Yasmin said, the events include education on fire safety and 2 hours of bowling for up to 4 or 5 people per lane. including shoe rental, pizza, and a pitcher of soda. So for tickets to the event and for sponsorship opportunities, please email destiny.hampton@umc.com or call 702-254-HOPE or 4672. Okay, we'll flash it on the screen for all of you guys. And you can also find the event information on Eventbrite with keywords of UMC Bowling Fundraiser. Did I do all right there?
Yes, perfect.
And you can also learn about the Firefighters of Southern Nevada Burn Foundation by visiting their website at www.theburnfoundation.org. Is that correct?
That's
Robert?
correct. Yes.
Okay, great. And of course, we can learn more about UMC Burn Care Center and their activities and the educational opportunities by visiting www.umcsn.com. Okay, anything to add to that, everyone?
No.
No,
Thanks. Thanks
just
for
come
having
out
us.
and have fun.
Yeah, we
It's gonna be a
sure
fun event.
will.
Yes.
Yeah,
Okay.
again, Ms. Doris, thank you very much, and Mr. Johan for allowing us to join you guys
Thank you.
tonight
Of
and
course, of
promoting
course.
our fundraising. And I'm encouraging everybody to join us and have fun, and it'll be a lot of fun.
That's good. So, you want to do the last question, or?
No, you can-
No, okay, I'll do the last question. So, one last question to all of you guys. As a healthcare and public safety provider, what message do you want to convey to our listeners and the public? Who wants to start? On the
We're all
spot.
like,
Okay. Cheri, tag you're it.
okay, there we go. Just be aware that there are multiple ways that you can get burned and to take precaution with those and reach out if you have any questions. There's a lot of stuff on social media and information that you can look at. It's really it.
That's really good. Okay. Robert?
For the fire prevention side, just do your due diligence. There's a lot of stuff these days is construction stuff's getting lighter, cheaper. We're seeing more synthetics. So it's stuff as simple as, changing your smoke detector batteries, twice a year, carbon monoxide detectors. We have a new big initiative in the industry where closing a door can stop the spread of a fire for up to an hour, from room to room. So just do your due diligence and educate yourself if you're not sure. And if you're not sure, come by a local fire station. We'll be happy to answer any questions, or, if your smoke alarm's broken, we'll come out and change it for free. That's part of the service of the fire service, is doing those little community outreaches. So,
So
please
that's good.
just educate yourself on some of the fire prevention.
Well, thank you for that, Mr. Firefighter. And Yasmin, what's your message to the public and our listeners?
So I would have to say this is probably geared towards the youth. I know that a lot of kids have been cooped up for a year and a half, and now that they're able to get out and they're curious, that teaching them at a young age that fire is a tool and not a toy. So teaching them at a young age how to use it appropriately and when is the appropriate time to use it, in cooking or a barbecue, using it for barbecue or a bonfire, and making sure that all those safety precautions are in place to prevent any kind of burn injury. So it's a team effort with the parents and the families. So just making sure that everybody is aware of the consequences out there, that it is a tool and not a toy.
Very good. I love that. Fire is a tool and not a toy. Okay. Mr. Lloyd, I'm going to have to, you have the last word on the messages.
Yeah, thank you. Well, as what they all say, basically it's down to just follow all the safety rules that we've been given to you guys, and when you guys join us this on October 9, you'll learn more about the safety rules or how to maybe save life, and if God forbid you'll be on that situation, you can use something that you learn, and hopefully, you'll be safe and no accidents will happen. But who knows, right? I mean, maybe a loved one that you know or a friend might need some help, And then we're just here. The burn care unit, UMC burn care unit, is always here for you guys, inpatient and outpatient. And we just want to let everybody know that we're here for you. That's all.
Awesome, awesome. Well, everyone, Cheri, Robert, Yasmin, and Lloyd, thank you very much for joining us tonight. We appreciate it so much. I know that you all have busy lives and busy jobs, and thank you for giving us the time to come over here to join us on our podcast.
Thank you. Thank you for
Thank
having
you.
us.
Yes, and I hope you come back again.
will.
Right?
We will.
Yeah,
Definitely.
okay. And to our listeners, we leave you with this. The American Burn Association states that roughly 450,000 patients receive hospital and emergency room treatment for burns each year. This statistics does not account for burn injuries treated in hospital clinics, private medical offices, or community health centers. And of these burn injuries, roughly 3,400 burn injuries deaths occur each year, according to the CDC. And burns and fires are the third leading cause of death in the home. Also, every day, over 300 children ages 0 to 19 are treated in the emergency rooms for burn-related injuries, and 2 children die as a result of being burned. And of course, younger children are more likely to sustain injuries from scald burns that are caused by hot liquids or steam, while other children are more likely to sustain injuries from flame burns that are caused by direct contact with fire. So, public awareness of burns and prevention of burns and an awareness of fire safety and its hazards are extremely important. Our community is lucky enough to have organizations such as the UMC Lions Burn Center, the Southern Nevada Burn Foundation, Firefighters, and District 46 Lions Club. Thank you, everyone, for all you do. And to our listeners, thank you for listening and tuning into our program. Thank you for giving us the privilege of your time. This is Doris Bauer, your Philippine Nurse host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine Nars, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.